Seeing kids open their new toys during the holidays is such a great sight, right? And while we can enjoy these moments, we do need to make sure we use precaution. Well, Dr. Jen Arnold and Petra Vibierlova from Johns Hopkins Children's Hospital are back with some very good advice and some things to keep in mind this time of year. Good morning, ladies.
Good morning.
Welcome back.
Great. Thanks for having us.
Well, and let's start with the statistics about how often this happens, because I think for some of us, for some families who this hasn't happened or we haven't seen this happen, we think, how hard, does this really happen all that often? Well, you say a lot.
It does. A lot more than I think most people realize. So about 250,000 ER visits happen every year due to either a choking issue with an infant or child, a poisoning, or even more risky swallowing caustic things like a battery. And these can be life-threatening injuries to children.
And scary. And you actually brought some things in, Petra, that are some good examples. And I think when we talk about, children opening gifts, a lot of times it's what siblings are getting as well, and accidents happen.
Yep. I mean, something can fall on the floor, or you can have it in your home.
Absolutely. So one of the things that we may want to look out for is age-appropriate labeling. And it could be something even for adults. For example, we found magnets. And magnets can be particularly dangerous, not even just one by one, but if the child swallows more, they can bind together inside and create a bigger, heavier object that can be very, very hard to remove. The rule of thumb is if it fits through your toilet paper tube, it's probably too small, a choking hazard.
Okay.
So keep it alert, and you can see how the magnets bind it even through the plastic cover. So this can happen in the internal organs and things like that while the child. Another very, very dangerous thing is button batteries, and manufacturers have done much better with covering the batteries, etc. But we always have remote controls and things like that that we have to look out for. And also these beautiful greeting cards. How cute would this be for a child to get?
There's a ton of them for kids.
A ton of them for kids. So if you are choosing to send it to somebody for their second birthday, etc., I would maybe steer away from that, or keep it somewhere up high where the child
maybe let them play with them,
because the battery is basically hidden right there,
and it can very easily come out.
Absolutely.
All right, so now let's talk about, let's say one of these objects does, we see that our child is choking. You've actually brought your buddy here.
Yes, this is our baby. We call her Tori, and she's going to give us a great demonstration for anyone who needs to know how to handle a choking when it happens at home.
What are some general rules of thumb kind of before you start that parents need to know or caregivers need to know?
Well, the first thing is to call 911 to seek emergency help. That's going to be really critical. So if there's more than one person in the home and your child is choking, you should call 911, ask someone else to call 911 while you perform the emergency
What if you're by yourself?
Procedures. Good question, because oftentimes we are by ourselves with our infant or child. So if you're by yourself, they recommend doing essentially what I'm going to show you, 5 maneuvers of the Heimlich, then calling 911, and then going back to performing the emergency procedure. Because
I think with babies, particularly this size, people are afraid to kind of get in there, and it's hard to know what to do.
Well, it's scary. It's your own child. They're in a life-threatening situation, and you have to then do procedures that potentially look painful, but you have to realize that it's not painful. You're saving their life in that moment.
And it's quiet, because if they're choking on something, from what I understand, they're not crying. It's not like you can hear them.
No, and in fact, it's an important first step is to know, is your baby able to cough or choke or able to cry? Because if that's the case, you're not completely obstructed in the airway. And you should let your child continue to cough to try and get out that foreign body.
So coughing is helpful.
Coughing is very helpful. And that is whether you're a child or an adult. Let them cough if they're able to cough. If you're not able to cough, if they're not able to breathe, you see them trying to breathe, but the chest isn't moving and they are not making any noise, then you know that they're in a situation where the airway is completely blocked. And that's when you need to perform an emergency procedure to try and remove and open their airway.
And how do we do that? Can you show us quickly, or are you going to show me how to do that?
Yes, I'm gonna show you. So this Tori, our baby, when something gets lodged in the airway, you'll notice that all of a sudden the child may turn red and then blue. And so we can see blueness in our baby today around the mouth, and then it can extend to the whole body if it's severe. And so that's the baby turns blue because the baby's not getting oxygen and they're not able to move air. And so initially you have to say, again, is the baby responsive? Are their eyes open? Are they trying to move around, trying to breathe, but maybe air isn't happening? They'll turn blue, but they will still be alert. Okay. And that's when you do, and that's when you're going to do your Heimlich maneuver. Okay. Now, this is important to know that if your baby's not alert, looks like they're asleep, completely unresponsive, and not breathing, that's when you go straight to CPR.
Okay, we are just about out of time, so I want to make sure what are our tips?
Do the Heimlich. Okay, Heimlich. So Heimlich maneuver. You take your baby on your arm, like this. Hold them on your forearm. Grab the jaw between your thumb and your forefinger. Flip the baby. And when you're holding the baby, head down. Okay. Oh yeah, thank you. Head down, lower than the butt. Gonna do 5 blows. 1, 2, 3, 4, 5. Those
pretty
blows,
hard?
Pretty hard.
Okay.
Between the shoulder blades, okay? 1, 2, 3, 4, 5. Then flip back to your forearm, hold the baby's head, and then you're gonna do 5 with your fingers between the nipples, right there. 1, 2, 3, 4, 5.
And you say, as we kind of wrap up here, if you can see it in their mouth, you are okay to grab it out, but don't go in there and try digging and searching for something if you don't see it.
Never try searching if you don't see a foreign body. If you see it in there, that's when you can pull it out. Would you like to try?
I know. Well, I think we're out of time now, and you did it so beautifully,
well, thank you. Yeah.
And this baby, I know you reach out to the community and you do classes on these, and this is just the beginning of kind of how they teach.
Well, the American Heart Association is a great place to look for classes on how to learn.
Ladies, thank you so much for coming in. A lot to keep in mind, but we're so thankful that we have people like you who help us remember and what to do in kind of these situations. Thank you so much.
Thank you.